So the incubation period for this disease is about 2 to 5 days. So bacteria, as I have discussed, that the bacteria is transferred through the respiratory droplets. So once the respiratory droplets enter into the respiratory tract, especially when it enter into the respiratory tract, the infection only actually it cause a localized infection. It means once it enters into the throat, so it causes a localized infection. So after entering into the throat, it produce a thick grayish exudate or a membrane, that is we call a pseudo membrane. I think I have a picture here. Here you can see this bacteria, it actually produce a membrane that is known as pseudo membrane. So this bacteria, it cause a restriction of a protein, and that will lead to a production of a membrane. This membrane is made up of a dead tissues or cellular debris. As I told you that this bacteria, it cause this toxin of this bacteria, it restrict the protein synthesis, so the cell will die. And when the cell die, they actually deposit it at the site, and they will produce a membrane that is a dark grayish in color, that is thick grayish in color, and this membrane is known as pseudomembrane. This is the most clinical feature, or you can say distinctive feature or a diagnostic feature of this diphtherial infection. So this pseudomembrane, it is composed of the cell debris. Okay, it contains the cell debris, it contains the mucosa, and it contains the inflammatory product. And this pseudomembrane, because it is a membrane, so it can extend into the nasal passage, or it may enter into the trachea. So what is the life threatening condition? If this pseudomembrane, if it pseudomembrane, it block the nasopharynx, if it block the nasopharynx, so there will be a suffocation. Because if it block the nasopharynx, there will be a suffocation, patient will have difficulty in breathing. Or if this pseudomembrane, it enter into the trachea, into the respiratory system, so what will happen? It may block the trachea, and when it block the trachea, the patient may die due to suffocation. So suffocation, there will be less oxygen, because patient will not be able to breathe properly. So this is its pathogenesis. So this the diagnosis of this diphtheria, it is very simple. If a patient have a cough, that is we call a whooping cough or a barking cough, and a patient have a pseudomembrane, we can easily see this with a tongue suppressor, we can easily see the pseudomembrane. So if your patient have a pseudomembrane, then it means the patient is infected with Clostridium diphtheria, because only this bacteria produce this pseudomembrane. So this pseudomembrane, it is consist of inflammatory mediators like WBCs. It is also contain the dead cells or cellular debris, dead cells, as well as it also contains the mucosa. And finally, they actually, the color of this membrane is grayish in color. So this is a distinctive feature of upper respiratory tract infection that is caused by Clostridium difficile, Clostridium diphtheria. And remember this bacteria, Corynebacterium diphtheria. Remember this infection is a localized infection. It is a localized infection, especially the upper respiratory tract infections. But this pseudomembrane can enter into the nasal passage. It can enter into the respiratory tract, where it can block the respiratory tract. So when it blocks the respiratory tract, there will be a hypoxia and patient die because of hypoxemia. Yes, class, understand?
Yes, sir.
Okay. The systemic infection, once the bacteria enter, like as I told you, mostly this bacteria cause a local infection. But in very rare condition, if the bacteria enter into the blood, actually not bacteria, the toxin, it enters into the blood, then it can involve the heart and peripheral nerves. If this bacteria it enters into the like blood, so this toxin can lead to a, it can cause inflammation in heart, and when it enter into the heart, it may cause myocarditis, inflammation of the heart muscles, and this myocarditis lead to a congestive heart failure, and heart failure lead to death. So systemic manifestation of this bacterial infection is, if it enter into the heart, if the toxin enter into the blood, and through the blood if toxin enter into the heart, in heart it can cause myocarditis. This myocarditis lead to a heart failure, and heart failure ultimately means it's a death. The second most important or common systemic manifestation is the involvement of the peripheral nerve. Involvement of the peripheral nerve, especially it involve the peripheral or this one spinal nerves. So this is its second systemic manifestation. So in nerves it causes neuritis. When the nerves are inflamed, there will be no neuronal conduction. When there is no neuronal conduction, so motor neuron will not produce a signal, so there will be a paralysis of muscles. So paralysis of respiratory muscles, there will be no respiration and patient die because of respiratory arrest. So these are the two important systemic manifestation of this infection. So in heart, it can cause myocarditis. In nerves, it can cause neuritis. But if it only involves the upper respiratory tract, then it may cause only a local infection. So as I said, it involve the peripheral nerves, but it may involve the cranial nerves as well. Cranial nerves. So if cranial nerves occur, infection of cranial nerve occur, it means that there will be no autonomic nervous system will be there. So this is actually the complication of this disease. So this is the systemic manifestation and a local infection of this respiratory tract infections of this bacteria. The other type of disease which this bacteria it cause, that is cutaneous diphtheria. Okay. Uh, Here you can see, sorry, I forgot to mention here, the clinical sign and symptoms. When we see a clinical sign and symptoms of this infection, the patient will have a fever, patient will have a cough, that is a barking cough, or we can call it the whooping cough. So patient will have whooping cough. There will be a pseudo membrane in a throat, and and there will be a swelling of the lymph node, or we can call it lymphadenopathy. So because of the swelling of the lymph node of the neck, it will lead to a swelling of the neck, and the patient neck appear as a buffalo neck. So this is also a sign, buffalo neck. It is also a sign of diphtherial or involvement of lymph node in this disease. Okay, so this is a, we call it the buffalo neck because it is swelled. So these are actually the sign and symptoms of this respiratory manifestation of diphtheria. The second, after this, we have a non-respiratory disease. Non-respiratory disease means the cutaneous one. The cuteness, I have explained you about this, the cuteness or involvement of skin. So this bacteria can enter into the skin through the wound. If the skin is injured, like if your skin have some injury, if the skin have some injured side, so this bacteria can enter into the body through the punctured wound, and it reside within the subcutaneous tissue. And within the subcutaneous tissue, it produces a chronic non-healing ulcer. Chronic non-healing ulcer. And the same time, because at the same time, it produces the same membrane, a grayish membrane, a gray membrane on the ulcer, on the skin. So that will show you that this is actually the diphtherial bacteria or diphtherial infection. So once enter into the skin, it produce the same pseudomembrane on the skin and produce non-healing ulcers. Non-healing ulcers. And another is the oil will be added in this infection by Streptococcus pyogen or Streptococcus aureus. So skin is already involved, skin is already damaged. So the other infections like Streptococcus pyogen and the Staphylococcus aureus, they may cause a super infection. So they may start affecting the skin. So this is known as super infection. So there will be a double infection. One infection is caused by diphtheria. The second infection will be caused by the Streptococcus and Staphylococcus aureus. So this may be a life-threatening condition if it is not treated well. So the diagnosis of this bacteria, we have laboratory diagnosis. So we can also perform a culturing technique. We can take a pseudomembrane culture and we can grow or regrow the bacteria in our laboratory. So microscopic laboratory diagnosis, we can look the microscopic morphology. We can stain these bacteria. As I told you, these are the non-motile, non-spore forming bacteria. And when you look at this slide, it is just like someone have written down the Chinese character. Okay, so they have Chinese letter-like arrangement. Along with that, this bacteria also have a metachromatic granules, or we can call it Babe's earnest. If you remember, we have also already discussed about this. These are the metachromatic granules which are present within this bacteria. So after the staining, we can also see these metachromatic granules, and this is a diagnostic feature of this bacteria. So we can easily diagnose this bacteria with this feature. So this bacteria can be cultured, can be isolated, or can be cultured in a it is cultured on this Tinsdale agar. So Tinsdale agar, it is a differential media. Tinsdale agar, it is a differential media because this media only allow the growth of cornybacteria, while rest of the bacteria cannot grow on this media. So this Tinsdale agar, it contains the potassium tellurite. So this potassium tellurite, it inhibits all the other respiratory bacteria. Instead, only cornybacteria can grow on this agar or on this media. So when we apply a sample taken from the respiratory tract, so only if the sample contain this cornybacteria, then only cornybacteria will be grown on the media. All other bacteria will be will not grow. So this is one of the, you can say, a differential media which can only allow a growth of cornybacterium. So we can take the sample from respiratory tract. Okay, we can also take the sample we can also take a biopsy sample of this pseudomembrane. We can also take that sample, and when we culture it, so we can use this Tinsdale agar, so that help us to identify, because on Tinsdale agar, it produces black colonies. Here you can see like a halos, black colonies. So this is also a laboratory diagnosis of this bacteria. Another identification for this bacteria, the laboratory identification of this bacteria, it can be like identified by a fermentation reaction. It is catalase positive, urease negative, and non-motile bacteria. So when you look at this culture of this bacteria, there is no any flagella or flagellum is there. So that is why this non-motile, catalase positive, urease negative bacteria. So that is also also the identification points for this bacteria in the laboratory. Yes, class. Any question?
No, sir.
No. Okay. So next we have the treatment of this bacteria. So the treatment of this bacteria, we need two type of treatment. First is, we know that this bacteria produce exotoxin. So one pathogenesis is the main pathogenesis is the circulatory toxin, and second pathogenesis is due to the bacteria, because bacteria is producing a toxin. So the treatment strategy is to eradicate the toxin, as well as to kill the bacteria, because if we kill the bacteria, toxins will not be produced, and ultimately we can stop producing the toxins. And second is neutralize the toxin, neutralize the diphtheria toxin. So for this purpose, we can use an antitoxin, and this antitoxin is produced from the horse protein. Actually, it is produced in the horse, and then these antitoxins are extracted from the blood of horse, horse. So there are two strategies. One is to neutralize the toxin, and second is to kill the bacteria. So a single dose of horse serum antitoxin, a single dose of horse antitoxin, horse antitoxin, it is actually provide a benefit, or it can neutralize all the circulatory toxin. So a single dose of horse serum antitoxins, it can inactivate the circulatory toxin. But remember, this antitoxin does not affect the toxin which is already bounded to the cell receptors. So it can only neutralize the free form of toxin. The toxin which is already present in the cell, we have discussed it has two fragment, A and B fragment. So the toxin which is already present within the cell, that cannot be inactivated. So it can only inactivate the toxin that is circulatory and free form. And because this toxin is produced from the horse serum or the horse, so about 10% of the patients, they may get allergic response against this horse protein. So this is also one of the treatment complication. So because patient may develop a serum sickness or a kind of allergic reaction against this horse protein, because these antitoxins are the protein which is produced in horses. So this is also another complication. So what is the drug of choice? The drug of choice is penicillin. We can use antibiotics to kill the bacteria. The latest guidelines they suggest that erythromycin erythromycin is now the first line drug. Erythromycin, sorry, mycin is now the first line drug for this. Erythromycin is the first line drug instead of penicillin. So now penicillin is second line drug. This is a new guidelines. So first choice is nowadays is erythromycin. If a patient have some kind of allergy to erythromycin, or if a patient has some problem, some complication with erythromycin, then we can use penicillin. Otherwise, erythromycin is useful. It is the first line choice nowadays. Okay, class. So this corny diphtheria, because it has a less resistant pattern, because that is why it can be easily killed with almost all type of antimicrobial drugs. So once a patient, remember this, this diphtheria is highly contagious. What is contagious? It can spread from one person to another person because it spread through air droplets, or sorry, this saliva droplets or respiratory droplets. So once your patient is confirmed that he is having diphtheria, that patient must be isolated. Otherwise, the patient, that person may spread this bacteria to other patients or other persons. So the patient should be isolated. So now this is actually the treatment and prevention. Actually, it is not prevention, it is just a treatment, and how we can prevent from the spread of the infection. The main prevention is we use the main prevention for this bacteria. Okay, I have explained this. The main prevention is immunization. The main prevention is immunization. And I have told you that nowadays we have DTaP vaccine is available. DTaP vaccine is available, which contain three toxides: diphtheria, tetanus, pertussis. So three antigens are there, three antitoxins are there. So DTaP, it is the first injection. We inject first injection within the first 2 years of life, and then after 10 years we repeat this injection, DTaP vaccine. So first injection we start in infancy. It should be within 2 years. And then the booster dose is we give after every 10 years of life. So nowadays, as I told you previously, nowadays this bacteria has been under control because every country have this DTaP in their vaccination plan. Uh, so the chances of diphtheria is now very less. Okay, it's very less. But those patients who did not receive the DTaP vaccination, or the patients who are immunocompromised, those patients then they are at a high risk for this Clostridium diphtheria infection. Okay, class. And then we have the diphthrioid. So diphthrioid means that there are some other cornybacterial species which are morphologically resembles with Clostridium diphtheria. There are some other species of cornybacteria which are similar to the Clostridium diphtheria, and they are also present in our body as a normal flora. They are maybe present in our nose, they are present maybe in throat, maybe nasopharynx, maybe skin, maybe urogenital tract, or maybe in eye. So these diphthrioid, because they are resembled with the cornybacterium, so that is why we call them diphthrioid. We call them diphthrioid. and these Diphthrioid, they are unable to produce the exotoxins, and normally they don't cause any disease. So that is why they are not clinically important, but they only cause disease when there is a immunocompromisation. So these are the diphthrioids. So diphthrioids are the clinically resembled, so not clinically, morphologically resembled cornybacteria, which resembled with the Cornybacterium diphtheriae. And these bacteria do not produce exotoxin. So this is actually the pictures you can see here. This is a pseudomembranous colitis, okay? And these are the drug of choices for the treatment of this cornybacteria. So that was all about your cornybacteria, okay? So in next lecture, we will start Bacillus species, okay? So if you have any question, please you can ask.